Good afternoon, everybody. My name is Wendell Potter. I want to thank you all for coming today. On behalf of Meredith College and the North Carolina Center for Health and Democracy, we look forward to spending the next hour discussing the state of healthcare here in North Carolina. I'm Wendell Potter. I am president of the Center for Health and Democracy, and probably better known as a former health insurance company executive that worked at Humana and Cigna for altogether 20 years, and probably even better known as a critic of the industry that I worked for. I became a very vocal critic of the industry, and I left the industry in 2008 and testified to Congress several times when Congress was debating what became the Affordable Care Act. So I spent a lot of time not only in the industry, but in more recent years as an observer and critic of the health insurance business. Since 2009, when I began my second career, maybe my third career, my first career actually was a newspaper reporter. I have become an author, and I run, again, the Center for Health and Democracy, North Carolina chapter here, and also an organization called Business Leaders for Healthcare Transformation, trying to get business leaders more engaged in focusing on healthcare reform issues. Frankly, we've seen an incredible increase in profits from big insurance companies nationally over the past decade. And those numbers have actually been skyrocketing since the beginning of the pandemic. One of the things that I do is look at the earnings reports of the biggest insurance companies, and in 2022, just 7 of the largest national for-profit insurance companies brought in $1.25 trillion in revenues. It's just a massive amount of money that flows through these companies now. And collectively, they made $69 billion. And they spent close to $30 billion, if not more, last year, buying back shares of their own stock rather than giving people relief from, for example, out-of-pocket costs. So while insurance companies are pulling in billions across the country, patients are receiving denial notices for in-network coverage, forcing them to fork up money to cover those treatments on their own, whether it's treatments or lab work or medications that they thought would be available to them because they've been paying premiums all this time. Simply put, patients are getting less and less for the premium dollars. There's a term for this in the insurance business that you may not have ever heard. It's called benefit buy-down. It's been going on for years and years. People have been paying more and more every year for their health insurance coverage through increasing premiums. But because of barriers that insurance companies have erected in various forms, it's becoming increasingly difficult for people to get the care that they need, even with insurance. North Carolina certainly is no stranger to these challenges. And by the way, this is my home state. It's good to be back here. I was born in Meredith, North Carolina. I haven't lived here in a long time. I currently live in Philadelphia, where Cigna was based when I was working for the company. It's great to be back here, and really proud that we have a Center for Health and Democracy here in North Carolina. Dr. McLennan and I will be talking in some detail about these trends and ultimately what we can hopefully do about it. And I will say that we will be bringing a lot of facts and figures, but I want you to keep in mind as we do that, we're talking about real lives here, real human beings, people that you know. Could be you that is in a situation which you need to get health care, but your health insurance company says no. Before I introduce Dr. McLennan, a couple of quick housekeeping items. There are index cards and pens that are available for you to write down questions for the Q&A segment at the end of our talk here. You can hand those cards to either Kate or Evan. There's Kate. Evan's back there in the back. So write them down. Any questions you have, hand them to either Kate or Evan, and they'll make sure that we get them. And for those of you joining us online, please use the question feature, and we'll have our AV team check for questions throughout this webinar. Now, I'm pleased to have Meredith College's own Dr. David McLennan here with us today. Dr. McLennan is the director of the Meredith Poll at Meredith College and a professor of political science and science for the 2022 Meredith Poll about North Carolinians and their health insurers, and his understanding of the public policy landscape here in North Carolina will be deeply helpful. So I'd like to turn it over to you, Dr. McLennan.
Thank you, Wendell, and welcome to Meredith College. For those of you who are not student or a faculty or staff member here, welcome to you online. We hope this session will be very informative to you and will inspire you to think more about this insurance industry that sometimes we take for granted. But as Wendell said, I direct the Meredith Poll and have done so since 2015, and we survey North Carolinians on a wide range of policy issues, healthcare being one of them, but we have surveyed on lots of other issues, everything from distracted driving, tax policy, etc. And so it gives us a great insight into the minds of North Carolinians about a range of things. This particular project gave us an opportunity to really drill down and understand health insurance from a consumer point of view, because we asked a lot of questions that we would not normally ask, but I think it was very revealing. And so I'll talk about some of those findings. But just suffice it to say that the takeaway from this is that North Carolinians are pretty satisfied with their health insurance company until they have to use the health insurance company, which is not particularly good. And this is the reason why we're here. So we surveyed well over 1,000 North Carolinians from all parts of the state. We had a sample that included young and old, black and white, brown. We included people with little education to a great deal of education. So it was a very good sample of consumers in North Carolina. We did restrict our sample to people who either got their insurance through an employer or purchased their insurance through HealthCare.gov. We intentionally did not use other forms of insurance because we were looking at that particular market. And we released these results in November, but they're still relevant today. Several other surveys, including national surveys, have been done since the Meredith Poll surveyed North Carolinians, and they have confirmed their findings. But let's kind of drill down a little bit. So like I said, most North Carolinians are pretty satisfied with their health insurance provider, whether it be Blue Cross or Cigna or any number of others. However, even among those who said they were satisfied, only 8.3% said that the health insurance company had their best interest in mind. And again, we compare that to other people in the health field, such as healthcare providers, your doctor, et cetera. And so again, that 8.3% was relatively low. So even though people like their health insurance company, they didn't believe necessarily the health insurance companies had their best health interest in mind. The other thing, which I've already said, which is that over 3/4 of North Carolinians thought that they were pretty satisfied or very satisfied with their health insurance provider. But when we started asking people about their experiences with the health insurance company, particularly when they had to start using their health insurance companies, we started seeing a significant drop off in their satisfaction levels. Now, that's not unusual. There are probably lots of things that you and I are satisfied with that once we start using them, we see satisfaction drop. So I'm not saying that health insurance is bad to me. We have a family friend, for example, who owns a funeral service. And I'll probably say pretty much categorically, when I have to use that funeral service, I'll probably be pretty unhappy. So just, again, that's lots of things. In all seriousness, lots of things. Phone companies, etc. But as we start talking to these consumers in North Carolina about their experiences with their health insurance company, I think it's worth noting that it's the negative experiences that start popping up at a higher rate in North Carolina than in other places. We invite you to read the white paper that's available in the back that Wendell authored that I contributed to. And we compare North Carolina results on, for example, claim denial to national standards, done by the Kaiser Family Foundation and groups like that. So North Carolinians, when they use their health insurance company and they get a denial of service, or they get a lot of paperwork they have to do for a claim or something along those lines, we see satisfaction fall to pretty low levels. That's not surprising. But again, a lot of North Carolinians don't have much experience with their insurance company, other than the routine physical and things like that, when they have to go to the hospital and make a claim or seek out some kind of surgery and they're told that it's not covered under their health insurance. Then they start getting very concerned about their health insurance company. Well, again, our poll confirms many of the findings by other polls. Forbes, for example, reported on a poll soon after the Meredith Poll was released, in which they found in a survey of over 2,000 Americans that most Americans were very satisfied with their health insurance company. Now, their survey did something a little bit different. They found that when they started asking people specific questions about health insurance, that most Americans don't know a lot about health insurance. 77% did not understand the term coinsurance. And over half of the people in the Forbes reported survey could not define what a copayment or a deductible is. So I think this is really part of the issue too, which is people who don't use their insurance for difficult claims really don't understand what they're paying. So again, whether it's the Meredith poll or other polls, dissatisfaction increases the more people interact with their insurance companies. They're often left with higher bills than they expect, medications that they can't access, and sometimes even surgeries, serious surgeries, that unless they can pay for it out of pocket, they don't get covered. So the implications of these problems they have with insurance companies are significant. And again, people are unaware of what their premiums are going for. Other findings from the fall survey indicated that 23.1% of North Carolinians had experiences in which their procedure was denied by their health insurance provider. Almost 1/4 of people who tried to use their health insurance were saying, we can't use it for whatever you're trying to get done. 20% submitted claims to their insurance company to have those denied. And 16% reported having to go through round after round of paperwork, which obviously leads to a lot of frustration. And again, 3/4 of the people who had experiences like this saw a significant decline in satisfaction with their health insurance provider. So what do all these results tell us? Again, to repeat the same thing I've already said, North Carolinians like their health insurance provider, as long as they don't have to use them. When they do, they find significant roadblocks, which affect not only their quality of care, but their perception of whether their insurance company cares about their service. And the thing I'd like to end with, and before I turn it over to Wendell, is about the lack of competition in the North Carolina health insurance marketplace. Here at Meredith College and many other employers provide one health insurance option for their employees. That's part of the problem. So many employers only provide their employees a single option. So even if people wanted to go to something other than their employer provided option, they couldn't. And 42% of people who were surveyed said they only have one option. So again, that's almost half of North Carolinians aren't able to compare. It's like in your cell phone, if there's only one cell phone provider, Well, probably you see your dissatisfaction levels go higher. Well, they're finding that here. This in comparison to people who do shop on healthcare.gov, who do pay for their own health insurance, their satisfaction levels are significantly higher than people whose employer only gives them one insurance option. And it's also true in terms of Medicare. Now we've seen increased competition in the Medicare market. Those folks do report higher levels of satisfaction. So again, what we seem to find from the Meredith Poll results is a pretty simple finding, is that competition could be something that really helps the health insurance marketplace. For those of you who've taken a basic economics course, or just simply are a consumer of other things, know that competition can be good. The airline industry seems to be getting smaller and smaller. That may cause us to find more dissatisfaction with the airline industry. So again, we're not talking about an industry that's fundamentally different than other industries. So again, we're going to talk a little bit more about solutions, but some of the solutions that we want to talk about have to do with competition. And I'm going to turn it over to Wendell, who really has done a lot of study about competition in the health insurance marketplace. And he'll talk to you about some of the other things in our white paper, and then we'll turn it over to you. Wendell?
Thank you, Dr. McLennan. What these Meredith Poll findings make clear, as Dr. McLennan said, is that North Carolinian sentiments around health insurance vary depending on their experiences with their health insurance provider. Our white paper, How Do We Fix Healthcare in North Carolina, looks at how minimal competition among health insurers and rampant claim denials, increasing premiums allow health insurance companies in North Carolina to restrict care, focus on revenue and profit increases with little competitive pressure to honor claims and ensure that coverage includes access to high quality care. The solutions, which we'll talk about toward the end of our time together, is to call for more patient options, more choices and access to care, and more transparency to ensure that North Carolinians get the care that they pay for and that they deserve. For now, let's dive into the key themes of this white paper. One of the big trends we're seeing is the rapid increase in health insurance revenues and profits here and across the country. Health insurance companies across the country are pulling in billions and billions of dollars in revenues and profits. Much of it began during the pandemic as unused premiums created a revenue and profit boom among the largest health insurance companies in the U.S. and really all across the country. Take United HealthCare as an example. United, as you probably know, is the largest health insurance company by revenue and profits. The company made $24 billion in profits in 2021 on nearly $290 billion in revenue. That actually increased to $28.4 billion last year, with revenue coming in at over $324 billion. Put that into perspective. There are only 4 companies in this country that are now bigger than United HealthCare. Any guesses? They're Walmart, Amazon, Apple, and one more right ahead of it, at least last year, was CVS, which owns that. So 2 of the country's biggest health insurers are now among the top 5 companies in the United States based on revenue. And that when I joined the industry, there were nowhere even close to the top 10, much less the top 5. United HealthCare reported a profit of $5.8 billion in the first quarter of this year, on top of a new record for revenue of almost $92 billion just for the first 3 months of this year. Blue Cross Blue Shield of North Carolina, which is, I think, this undoubtedly the state's largest health insurer, certainly when it comes to enrollment, has also seen a similar increase in revenue and income, while premiums have been increasing. In 2021, the company reported nearly $11 billion in revenue with net income of about $560 million. On top of that, it received a 7.2% rate increase for customers in 2023. I do like 2022 data point from Value Penguin showed that North Carolinians ranked 10th in the nation for health insurance costs. 10th. The average monthly costs here were $634 with an annual cost of $7,608, which is more than 17% higher than the national average. I think that gives you an indication that the lack of competition undoubtedly is playing some role in that here. The data was aggregated from premium rates from the Centers for Medicare and Medicaid Services. The averages were calculated for a variety of variables such as the medical tier. When we're talking about the gold, silver, bronze levels in the Affordable Care Act marketplaces, family size or county, and calculated from the silver plan for 40-year-olds. You may say that, like many businesses, health insurance companies are just keeping up with the cost of doing business. There's a little mistake about it. Health insurance companies are, though, they're getting very much bigger, very richer, while patients are getting less and less for the premium dollar. And that goes back again to what I was referring to, benefit buy down, which has been going on for a long time. While I was at Cigna, one of the things that I did was handle financial communications. Every time we announced earnings, my name was on every one of Cigna's earnings reports for 10 years. So I know how these companies make money and where it comes from and what they do with it. And increasingly, they're keeping it or sharing it with their executives or pulling it out to their shareholders or their executives. There's a little mistake about it, again, that health insurers are getting bigger and richer every day. And changes are coming from how insurance companies operate. Bills, as you undoubtedly know, have been filed with the legislature here in North Carolina that would allow the Blue Cross Blue Shield of North Carolina to transfer its assets from to a new nonprofit holding company that would operate without regulatory constraints that are normally imposed by state law. Your insurance commissioner, Mike Causey, has expressed his opposition to this bill. And I hope that lawmakers will oppose this bill as well, too. From what I gather about the bill, it just doesn't make a lot of sense. There are a lot of questions that haven't been answered about what the company's real motives are. At the very least, I would think, or at the most, I would think that lawmakers should take at least a year to more clearly understand what that company is wanting to do and not pass this bill. It certainly requires, I think, more scrutiny, more sunlight. As your insurance commissioner said, and I quote, "This bill is about corporate greed," and I have seen a lot of corporate greed today, and I would say that that's exactly right. We'll have to wait and see what the actions actually, how they develop, what lawmakers do, that'll result will this result in more competition or diminish competition in this state? Now, let's turn a bit to denials and appeals. One of the main ways that insurance companies increase their profits and push payments to higher prices is through denials of care. National data from a public accounting firm, Crow LLP, found that denials rose to 11% of all claims in 2022. 11%, in other words, of all claims in 2022 were denied. That's up from 8% in just 1 year, 2021. It may come as no surprise that North Carolinians' denial numbers are also high. According to data from the Kaiser Family Foundation, which analyzed health insurance through HealthCare.gov, it found that 2.9 million North Carolinians were denied care by Blue Cross Blue Shield alone each year in 2020 and 2021. And I want to remind you, once again, we're talking about people. We're talking about people you could be related to, who found that some care that they needed was being denied. But frankly, more denials for health insurers means more dollars that they get to keep and higher profits. And appeals are virtually non-existent. The Kaiser data found that 0.1% of denied claims were billed nationally in 2020, and just 0.2% were filed in 2021. Patients that were able to, well, what this tells you is that the process of appealing a denial is extraordinarily complicated, and that is by design. Insurance companies want it to be difficult for you to understand even that you have that right of appeal. A lot of people don't even know it. But even if they do, the people just think it's almost hopeless. And also keep in mind too, that a lot of folks are sick or disabled, and having the energy, having the ability to negotiate or to try to get a denial reversed is more than people just think they can do. But it's important to know that when people do appeal a denial, there's a very, very good chance it will be overturned. In fact, numbers have shown that upwards of 40% of claims that are denied and appealed are ultimately paid. Now, there's one thing I think that we all can agree on, and that is that healthcare costs continue to go up. Even before inflation climbed to a recent high of 8.2% nationally, the average American could not afford to cover an emergency expense of $400. A recent Gallup poll found that 38% of American adults are putting off medical treatment due to cost. And most of those folks have insurance. Many others studies back that up, including here in North Carolina. And Forbes advisor analysis found that over half, 51.1% of North Carolinians reported an unmet need for mental health services that they didn't receive because of the cost. That 38% Gallup number, by the way, is the highest since Gallup started tracking the issue. Dr. McLennan's poll found that 1 of every 4 North Carolinians think that health insurers play an outsized role in rising healthcare costs. As a former health insurance industry executive, I can assure you those folks are right. And not only that, insurers have been erecting barriers to care that make it more and more difficult, make it in many cases impossible for people to get the care that they need. Those barriers include high out-of-pocket costs, the co-payments that Dr. McLennan referred to earlier, that few people even know what they are, much less that they're going to be subjected to them if they get sick. Out-of-pockets take the form of co-payments, co-insurance, and deductibles. I, by the way, lead an organization called Lower Out-of-Pockets Now. Because these out-of-pocket costs have gotten so high, more and more people are not able to use their coverage. The Affordable Care Act chose to limit, or the lawmakers and through the Affordable Care Act put a limit on how much insurers can charge out of pocket, but it is extraordinarily high. $7,100 for an individual this year, and actually $18,000. I think it's $9,100 for an individual, $18,200 for a family. People just don't have that kind of money. Health plans have created very limited provider networks that make it harder for patients to get the care that they need from in-network doctors and clinics. And in some cases, insurers like United are directing patients to receive care and driving them to care sites that they own. Increasingly, United and CVS and Cigna and other companies are buying providers through what's referred to as vertical integration. Oftentimes, patients are being put in a bind when it comes to specialty care and critical services like that in particular. Taken as an example, what United HealthCare did here in North Carolina a couple of years ago with the state's largest anesthesia providers. The company terminated long-standing agreements that left thousands of patients with limited access to in-network anesthesia care just as the pandemic was getting underway. Patients at some facilities were left with an in-network anesthesiologist and some prize bills that ranged up to $15,000, and it led to some patients in the Charlotte area suing United. Members of Congress, the American Medical Association, and dozens of other healthcare groups, including the North Carolina Medical Association, have warned about this practice by insurers. These types of red flag practices must be stopped to preserve access and affordability to quality care. Now, let's move on to some potential solutions. Dr. McLennan and I have spent a great deal of time so far talking about the many challenges with health insurance companies here in North Carolina, from consumer sentiment about health insurance to denied claims and health insurance profits. There are many obstacles when it comes to accessing care across the country and here in North Carolina, as we mentioned. But what are some of the solutions? Any fixes to the health care industry in North Carolina and nationally will take time, of course, and significant collaboration among insurance companies, healthcare providers, and policymakers. But there are some ideas that are worth considering now, such as diversifying health care insurance options in North Carolina. And I think maybe, Dr. McLennan, it's time for you and I to just have sit down and talk about some of these issues, some of these potential solutions.
As we're doing this, we encourage you to write any questions you may have, and we'll be glad to take as many questions as we can. One of the things Wendell and I were talking about before the session began was the motive of Blue Cross and Blue Shield through this legislation to move their holdings into an unregulated nonprofit. And as many companies do, they like to buy up the competition. And so we were concerned that Blue Cross and Blue Shield potentially, that I've not spoken to anybody about Blue Cross and Blue Shield, but if Blue Cross Blue Shield does buy up smaller health insurance companies, that just makes it a less competitive market. What are some other thoughts about how to increase competition?
I think that's what lawmakers should be looking at, rather than granting some additional leeway to Blue Cross Blue Shield of North Carolina. You really have to look at, as I said, some of these barriers that insurance companies have put in place. But what can lawmakers do to actually increase competition? Blue Cross Blue Shield of North Carolina, as I understand it, has about an 83% market share for people who buy their coverage to the individual market, 80% of people who get their coverage to the group market, mostly employer-sponsored coverage. That's a lot. That is huge market share. And I would argue that because of Blue Cross Blue Shield of North Carolina's size, it is able to keep competitors at bay. It's almost remarkable that Aetna was able to win that contract, which I'm sure Blue Cross was annoyed because they've been able to call the shots in the state for so long. So maybe it was a wake-up call, but I would imagine that it was also a wake-up call for the executives of that company to go to the legislature, the friends in the legislature, and say, "Liz, we need some more help to protect our market share and our profits." So that, in my view, is what's going on here. But you need to look at not what is best for Blue Cross, but what is best for patients, for consumers here in North Carolina. In my view, lawmakers should be looking at what can be done to increase competitiveness. That's what would make it more likely that companies from other states might even want to set up shop here. What if Blue Cross Tennessee wanted to sell policies here in North Carolina? A few years ago, it was a big talking point, particularly among Republicans, that let's break down those barriers to allow more competition across state lines. Blue Cross Tennessee is a nonprofit too. What can the state do to encourage more competition is one of the things I would suggest that they would do. But also look at the experience that people have right now. One of the things, by the way, that gives a great advantage to insurance companies is exactly this phenomenon that we go year by year being relatively healthy. We don't even know the limits of our insurance coverage until we get sick or injured. And then that is when we become very dissatisfied with their coverage. So I think lawmakers should be looking at the reasons for the dissatisfaction of North Carolinians when they get sick, when they get injured, and look at ways that patients can be protected more than the profits of Blue Cross and Blue Shield of North Carolina. I think policy caps should be considered on how much an individual insurer, how much market share an insurer should have in different parts of the health insurance market. I think the state should look at denial rates very closely and determine the appropriateness of those denial rates. There needs to be greater transparency. Insurance companies notoriously have been very opaque. They have been very reticent to provide important data for policymakers to study. So that's something that needs to be done. The appeals process needs to be explained to consumers more than they have and streamlined to make sure that people not only know that they have the option of appealing a denial, but that it's more likely that they would be able to do that and not encounter frustrations and roadblocks. And we need to have insights into how health insurance companies can use premium increases. I mean, in other words, how necessary are those premium increases if they come back year after year, even as they are saddling more and more people with out-of-pocket costs. That, by the way, folks, is one of the reasons these companies are able to amass such enormous sums of money. They're not only increasing premiums year after year, but they're making us, if we have insurance, pay money we just simply don't have before our coverage kicks in. That is what lawmakers ought to be looking at, in my view, in this state, rather than giving Blue Cross, Blue Shield what it wants, whatever it wants. Now, maybe we can go in to see what some of the questions are from the audience.
The first one, why are copay costs rising? How can limits be put on Blue Cross Blue Shield, and what can we do? I can repeat it.
Yeah.
Why are copay costs rising, and how can we put limits? How can limits be put on Blue Cross Blue Shield, and what can we do?
They're rising because insurance companies have so much power, so much ability to do that. They increase them because they can. And because employers are not paying enough attention to what's going on to their workers, and policymakers are not paying enough attention. I mean, it is absolutely ludicrous that Congress allowed a bill to pass called the Affordable Care Act that now allows people to be on the hook, families, for out-of-pockets of over $18,000 before their coverage kicks in. Lawmakers in other states are looking at what can be done to cap out-of-pocket expenses, including copayments and deductibles, whether it's on particular medications or on care more broadly. So that's what, in my view, it will take government regulation at the state and federal level before you're going to see this change, because as long as policymakers and the rest of us say, well, let's just let the so-called free market work its way, we're going to continue this. The free market, as we know it in healthcare right now, works for Blue Cross and Blue Shield of North Carolina, not so much for the rest of us.
Something is in the same vein. It seems that regulatory agencies are not doing a good job by granting rate hikes while profits are soaring. What more can regulators do?
Well, we need to have different regulators in place to a large extent. What you have here, I'm sure, certainly in Washington and around the country, is something called regulatory capture. You see a revolving door usually of people going from industry into government and then back into industry. Former colleague of mine at Cigna became the insurance commissioner of the state of Connecticut. That's not at all unusual. I used to be a consumer rep to the National Association of Insurance Commissioners, which is an organization that comprises all of the state's insurance commissioners. I was one of about a dozen consumer reps. When you go to their conferences, the NAIC's conferences, I was astonished to find that we were outnumbered incredibly. There were about 1,000 lobbyists from insurance companies and others in the industry at these meetings. That's what you're up against, the enormous amounts of lobbying dollars in places you didn't even know existed, like this NAIC conferences. Blue Cross Blue Shield here in North Carolina has dozens of lobbyists. And they also, by the way, have a political action committee, and they dole out lots of money to candidates. Looked at the most recent election cycle, 3/4 of the political action spending from Blue Cross of North Carolina went to Republicans. It's not always that case, but that was the case this past time. Sometimes they've given more to Democrats, but typically it depends on who is in power, who they think needs to be influenced, who their friends are. But they give money to both Democrats and Republicans. But it is something that regulators must do to look at this in a way that is not just bending to the will of big companies like Blue Cross.
Do you consider any particular states a model for managing these insurance company issues?
Some states absolutely have done a better job than others. Year before last in Colorado and Nevada, the residents there, advocates there, were able to get the legislature in those states to enact legislation to create a state-based public option, for example. And those states are moving forward with that. California, Colorado a bit more rapidly than Nevada. But that is something that I think other states should look at and consider doing. It is a way of injecting more competition into a state. Big insurers were able to keep it out of the Affordable Care Act, as you may know, but some states were looking at that. California is last year, a couple of years ago, the governor and legislature appointed some folks to study what the state should do to get to universal coverage and to increase competition, to bring down the cost of care and the cost of health insurance. And that was a pretty darn good commission report, and lawmakers there are studying that now, and it's going to be the basis of legislation that is being considered in Sacramento. I would think that could be something that the governor and legislators here would consider. What can be done here? There are a lot of North Carolinians who are uninsured. Far more are underinsured. That means they are in health insurance plans that have such high out-of-pocket costs, like deductibles, co-payments, and co-insurance obligations. They're not getting the care that they need. So what can the state do? Look at what other states are doing, like California, Colorado, Nevada, and other places that are looking to try to improve the lives of the people who actually can vote for them, rather than the people who can just write campaign checks.
The white paper indicates that the number of North Carolina insurers dropped from 31 to 11. What do you attribute this drop?
Consolidation. And this is called horizontal consolidation or integration. And that was what has been happening across the country. When I went to work for Humana in 1989, there were hundreds of insurance companies across the country. Over the course of the last several years, you've seen rapid consolidation in the health insurance business, to the point that the big players have bought up almost everybody they want to buy up. So they have gone into what's referred to as vertical integration, getting more and more into the delivery of healthcare, buying physician practices. You may not know this, but United Healthcare is the nation's biggest employer of doctors in the country now, through their many acquisitions of physician practices. They own a lot of clinics as well. You have a lot of competition among physicians and insurance, among hospitals and insurance companies to buy physician practices, but the insurance companies are winning. When you've got United being the biggest employer of doctors, that ought to scare you a little bit. It scares me. That's what's been going on. The rapid consolidation among health insurers. You now have 7 very, very large for-profit insurance companies. As I said earlier, last year they brought in over $1.25 trillion in revenues. All of those companies got to be as big as they are through acquisitions of smaller competitors. So you have that consolidation, and they've been able to do this again. When I mentioned regulatory capture, they've been able to get their deals approved by regulators who just really have been turning the other way. The concern that I have now is what I think Blue Cross probably wants to do, what its real motive is to be able to get deeper and deeper into healthcare delivery, to be able to buy, and that would enable it to do what United is doing, what Aetna and some others are doing. You capture the premiums and you use those premium dollars and you can steer patients to your own clinics or your own physician practices. That is what I suspect is really at play here. What they want to do, they want to mimic what some of the big for-profits are doing. And I think rather than that, lawmakers should be looking at what the big companies are doing, break those companies up. And by the way, that's a possibility. The FTC is beginning to look at long last at some of the mergers and acquisitions among big insurance companies, in particular their acquisitions of pharmacy benefit management companies. And there's a lot of interest on both sides of the political aisle in Washington to look at how these big companies have been ripping off taxpayers in the Medicare Advantage program and through their PBMs.
I think a good follow-up question then, how do you tap market share percentages of insurance companies serving North Carolina? What's the mechanism?
I think that's something that lawmakers would have to investigate and see what other states might be able to have been able to do. But some states, by the way, have enacted legislation that allows their insurance commissioners to be more aggressive in reviewing and approving rate increases. I'm not sure what the situation here is in North Carolina, but that would be a worthy thing that lawmakers could consider doing. Why shouldn't insurance commissioners be more able, have greater capacity and ability to reject outrageous or unjustified rate increases? That's one way. I mean, just some more appropriate regulatory oversight would, I think, adjust or lead to the adjustment of market share. I guess at an extreme, it could be limiting market share, but probably maybe a more prudent approach, more palatable approach would be looking at what regulators can do to address premium increases and out-of-pocket costs.
Dr. McLennan, I think this is for you. Did you find any correlation between the level of education and healthcare satisfaction?
That's a really good question. We found that there was no correlation, that people who across the sort of educational attainment spectrum all felt about the same way. They were all initially satisfied with their insurance companies, and then those who had denials of service, for example, or unnecessary paperwork in their minds, found their satisfaction go down. So the findings are pretty universal across all demographic groups. Didn't matter whether the person was educated or not, the person was white or black, whether the person was a Democrat or Republican, or what geographic region in North Carolina the person was from.
We have a couple that asked a sort of similar, what are health insurance companies doing for us? Kind of question. And if profit is their main motivator, how do we keep them from denying care or running away with it?
If you look abroad, you know that health insurance companies actually are not essential. Now, that to wish them away in this country is I think foolishness because they're so entrenched. My own point is you've got hospitals and physician practices, clinics, pharmaceutical companies. They actually provide goods and services that we need. We need to stay healthy and to extend our lives, to improve our lives. Insurance companies, not so much. Insurance companies, and in fact, Blue Cross began in the 1930s. Around the same time, a lot of blues were coming into being across the country. They actually started in Houston, Texas, when an executive at Baylor Hospital decided to come up with this idea of selling a form of what became a form of insurance, so that school teachers in the Houston area, I think it's Houston, maybe Dallas, were able to get hospital care at a very modest price. This was at the end of during the Depression. That concept took hold and became the Blue Cross system, which was initially to provide access to hospital care. All the policies were community rated, which meant that everybody paid the same rate. And we've moved far away from that as more and more companies like Cigna and Humana that are for-profit moved into the space. So you've seen that even Blue Cross and Blue Shield in North Carolina conduct business pretty much the way that the for-profits do. The industry is largely led by the big for-profits. But that doesn't mean that the nonprofits are just getting by. They're making money hand over fist as well, too, doing very well. And you see in a state like North Carolina, they have massive market share. They're not essential like hospitals and doctors are. They should be regulated more carefully, in my view, and more aggressively than they have been. But you've got the ability in this country, and my second book was called Nation on the Takeout, Big Money Corrupts Our Democracy and What We Can Do About It. The problem, the real heart of the problem, is the ability of these big companies to protect their profits, their profit margins, their market share through campaign contributions and through massive amounts of lobbying.
One other point, if you compare the lobbyists and PAC money that comes from insurance companies and other providers to consumer kind of interest groups, I mean, it's a factor of 10 to 15. So there are consumer advocacy groups working on behalf of citizens and consumers, but their power is just so much smaller than that of the insurance companies.
You do have some very good advocates, very good advocacy organizations that are doing really, really, I would about the Lord's work to try to protect the interests of patients and consumers. But they're heavily outspent.
Do you know if there's polling about how doctors and nurses feel about insurance status quo?
I'd probably refer people to Kaiser. I mean, I've not done that, and I've not known anybody else in North Carolina to have done that, but
there are various surveys that are being done, some that, you have to take a look at the source, but doctors increasingly are burning out, and it's largely because of the hoops they have to jump through to get care for their patients. There's a term that's being used in healthcare that came out of war. It's called moral injury, and increasingly doctors are victims of moral injury. They know that there is more that they can and should be doing for their patients, but increasingly their hands are tied because of the restrictions being placed on them by insurance companies. The profession with the highest suicide rate in this country are doctors. Hundreds of thousands of doctors and nurses have left the profession, and it's largely because of the onerous working conditions that they're under, largely because of private insurance companies.
what are important trends in regulatory environment, federal, harmony across states and in North Carolina?
I can start with that. Like I said, in Washington, we're finally seeing lawmakers beginning to wake up. Even Democrats are realizing that there are big flaws in the Affordable Care Act. Zeke Emanuel, Dr. Zeke Emanuel, who was in a Obama administration at the time that the Affordable Care Act was being written, he helped influence that, said that that not paying enough attention to what insurance companies would do, in particular, saddling people with out-of-pocket costs, was a huge mistake. They just were believing the insurance industry's lobbyists too much. I'm glad that the Affordable Care Act did pass because it did do a lot of good, in my view, brought a lot of people into coverage, but it created a situation in which we had a new crisis in this country, and it's a crisis of underinsurance. A lot of people have such high deductibles, and I keep mentioning that, but they're functionally uninsured now. So that, in my view, is a huge, huge problem. It's something that lawmakers at the federal and state level must do. And like I said, I think lawmakers and regulators are beginning to wake up in Washington. You've got just this week, Senator Bernie Sanders and Senator Cassidy, a Republican, are co-sponsoring legislation that will address the aggressiveness of pharmacy benefit managers, which now are contributing hugely to the profits of these big companies. You're seeing a lot more attention being paid to how these big insurers have ripped off taxpayers through the Medicare program, the Medicare Advantage program. So you're seeing lawmakers, at least in DC, beginning to wake up and not rolling over every time an insurance company lobbyist comes calling.
We have time for just one more. What will the recent Medicaid expansion mean in North Carolina?
Well, one caveat there, even if the governor signed it, there's still one more hurdle to go through. That's the budget. So if it does make it through the budget process, I mean, the obvious one is 500,000 to 600,000 more North Carolinians will have some form of coverage. So that's good. But to tie it back to our discussion, you know, it's still hooked into the providers and the insurance companies. So good news for those 500,000 to 600,000 people who might have more access. The question is, will there be enough competition to provide the best care possible?
That's right. And something that people need to understand is that in the Medicaid program, most states work with private insurance companies to manage the benefits of Medicaid beneficiaries. Some states, there are multiple companies, and some states, very few. One state, Connecticut, decided a few years ago to that they could do a better job, and they bucked the trend and went back to having just the state administer the Medicaid program, and they've saved a lot of money. They've achieved a great deal, which is something that I think is really important to know, is that once you there's this belief, almost a tentative belief, that private companies can do a better job than the government in anything. But when it comes to healthcare, you see the profit motives of what happens so much when you have insurance companies controlling so much of our healthcare system. Almost 50% of Medicare enrollees are now enrolled in Medicare Advantage plans. That has become one of the industry's big cash cows. But also the big companies are making money hand over fist the Medicaid program. Centene and Molina, Elevance in particular, but also United HealthCare are huge in the Medicaid program. So I think it's important, and I hope the expansion goes forward. But keep an eye on how those benefits are administered and whether the states get ripped off by big insurance companies. It can make a big difference in people's lives.
Thank you, Dr. McLennan. Thank you, Wendell.
Thank you all for coming.
Thank you very much.
Drinks out there.